The landscape of medical research has been profoundly shaped by a singular pivotal document. This foundational text emerged from a critical need to safeguard human dignity in scientific pursuits. It stands as a testament to the global medical community's commitment to ethical conduct. Adopted by the World Medical Association in 1964, this declaration marked a turning point. It provided a comprehensive framework for ethical considerations in medical research. Its principles were designed to guide physicians and researchers across the globe. The Declaration of Helsinki serves as a cornerstone of medical ethics. It articulates the fundamental ethical principles for all medical research involving human subjects. This document is not merely a set of guidelines, it is a moral compass. Its core purpose is multifaceted, yet singularly focused on the individual. It aims to protect the fundamental rights of research participants. Every clause and every principle is designed with this paramount objective in mind. Furthermore, the Declaration meticulously addresses the safety of research participants. It mandates that all studies must prioritize the physical and psychological well-being of those involved. No scientific gain can justify compromising a participant's health. The well-being of research participants is consistently emphasized throughout the document. This includes their comfort, privacy, and overall human dignity. Researchers are ethically bound to uphold these standards. Crucially, the Declaration of Helsinki unequivocally prioritizes participant interests. These interests must always stand above the interests of science or society. This principle forms the bedrock of ethical human research. It asserts that the welfare of the individual subject must take precedence. This means that potential benefits to society or scientific advancement cannot override the rights and safety of any single participant. This ethical stance is unwavering. One of the most critical pillars of the Declaration of Helsinki is the principle of informed consent. This concept ensures that individuals retain autonomy over their participation in research. It is a non-negotiable requirement for ethical studies. Participants must be fully informed about every aspect of the research they are considering joining. This transparency is essential for genuine consent. Without complete information, consent cannot be truly informed. The information provided must include the precise purpose of the research. Participants need to understand why the study is being conducted. They also need to know the specific methods that will be employed. Crucially, participants must be made aware of all potential risks associated with the research. This includes physical, psychological, and social risks. They must also be informed of any potential benefits, both to themselves and to others. A fundamental right enshrined in the Declaration is the participant's ability to withdraw at any time. This right can be exercised without penalty or loss of benefits to which they are otherwise entitled. It underscores the voluntary nature of participation. Consent itself must be entirely voluntary, free from coercion or undue influence. Researchers must ensure that participants feel no pressure to join or remain in a study. True consent comes from a place of free choice. Finally, consent must be properly documented. This usually involves a signed consent form, but other verifiable methods may be appropriate. Documentation provides a clear record of the participants' agreement. The Declaration recognizes that certain groups require additional protection. These are known as vulnerable populations, and they necessitate enhanced safeguards. Their unique circumstances demand extra ethical consideration. Additional safeguards are specifically required for these vulnerable groups. This ensures their rights and welfare are not exploited. Researchers must demonstrate a heightened level of care and responsibility. Examples of vulnerable populations include children who cannot legally provide consent for themselves. Individuals with impaired decision-making capacity also fall into this category. This might include those with cognitive disabilities or severe mental illness. For these groups, the Declaration mandates consent from a legal guardian or authorized representative. This proxy consent ensures that the participants' best interests are represented. It acts as an essential layer of protection. Even with proxy consent, researchers must still seek the assent of the vulnerable individual whenever possible. This means gaining their agreement to participate, even if they cannot legally consent. Respect for their wishes remains paramount. The research must also be directly related to the health needs of the vulnerable population. It should not be conducted on them if it could be equally well carried out on non-vulnerable individuals. This prevents exploitation. Furthermore, the research should offer a reasonable likelihood of benefit to the vulnerable group. This could be direct benefit to the individual or to the population they represent. The ethical bar is set higher for these studies. Beyond individual consent, the Declaration of Helsinki also mandates rigorous scientific standards. Ethical research is inherently good science. Poorly designed research is unethical because it exposes participants to risks without the potential for valid results. Research must be based on sound scientific principles. This means the study design must be robust, the methodology appropriate, and the research question relevant. Scientific integrity is a prerequisite for ethical approval. Where applicable, the declaration requires prior animal experimentation. This step helps to assess the safety and potential efficacy of interventions before human trials begin. It minimizes risks to human subjects. The research must be conducted by scientifically qualified individuals. Researchers must possess the necessary expertise and experience to carry out the study competently. This ensures both safety and scientific rigor. Crucially, all research involving human subjects requires oversight by an independent ethics committee. This committee, often known as an institutional review board, provides an impartial review. Its independence is vital to its function. The ethics committee reviews the entire research protocol before any study can commence. This comprehensive review covers all aspects of the study design, participant recruitment, and data handling. It scrutinizes every detail for ethical compliance. This independent oversight ensures adherence to ethical guidelines and participant rights. The committee acts as a guardian of the participants' welfare. It has the authority to approve, modify, or reject research proposals. The committee's role extends beyond initial approval. It also monitors ongoing research. This continuous oversight ensures that ethical standards are maintained throughout the study's duration. Any deviations must be reported and addressed. The composition of the ethics committee is also important. It should include members with diverse backgrounds, including scientific, medical, and non-scientific perspectives. This multidisciplinary approach strengthens its ethical review. Conflicts of interest among committee members must be carefully managed. Members with a vested interest in a particular study should recuse themselves from its review. This maintains the committee's impartiality. The declaration emphasizes that the ethics committee must consider the ethical implications of the research in the context of the country where it is conducted. Local cultural and legal norms are important, but they must not diminish the universal ethical principles. The Declaration of Helsinki distinguishes between two primary types of medical research. This distinction is crucial because it dictates different ethical requirements and levels of scrutiny. Understanding these categories is fundamental to applying the Declaration's principles. It differentiates between therapeutic research and non-therapeutic research. Each type serves a distinct purpose and carries different ethical considerations, particularly regarding the potential for direct benefit to the participant. This classification helps to tailor ethical oversight. Therapeutic research has a primary goal of benefiting the patient who is participating in the study. In this type of research, the intervention being tested is intended to diagnose, treat, or prevent a disease in the individual subject. The participant is also a patient. For example, a clinical trial testing a new drug for a specific illness in patients suffering from that illness would be considered therapeutic research. The hope is that the experimental treatment will improve their condition. The potential for direct benefit is a key characteristic. Conversely, non-therapeutic research has a primary goal of gaining new knowledge. The intervention or procedure being studied is not intended to directly benefit the individual participant. Its aim is to advance scientific understanding. An example of non-therapeutic research might be a study investigating the normal physiological responses of healthy volunteers to a specific stimulus. While the knowledge gained may eventually benefit others, there is no direct therapeutic benefit to the participant. This distinction is vital for ethical review. Stricter requirements are generally applied to non-therapeutic research, especially when involving vulnerable populations. Since there is no direct benefit to the participant, the justification for any risk must be exceptionally strong. The ethical bar is significantly higher. For non-therapeutic research, the risks to participants must be minimal. The potential for harm must be carefully weighed against the importance of the knowledge to be gained. This balance is a critical ethical consideration. When vulnerable populations are involved in non-therapeutic research, the ethical scrutiny intensifies further. The research must be of paramount importance, and the risks must be negligible. This ensures that vulnerable individuals are not exploited for scientific gain. The Declaration emphasizes that in non-therapeutic research, the participants' well-being must be protected with even greater vigilance. The absence of direct benefit means that any potential harm is less easily justified. This distinction underpins much of the Declaration's protective framework. The Declaration of Helsinki is not a static document. It is a living testament to evolving ethical thought. Since its initial adoption in 1964, it has been revised multiple times. These revisions reflect the dynamic nature of medical science and the ethical challenges it presents. These updates address new scientific advancements, emerging ethical dilemmas, and a deeper understanding of participant protection. Each revision has aimed to strengthen the safeguards for individuals involved in research. The Declaration adapts to a changing world. Early revisions, for instance, strengthened protections for participants by clarifying the informed consent process. They emphasized the voluntary nature of participation and the right to withdraw. These enhancements made the document more robust. Provisions were also added concerning the ethical use of placebo controls in clinical trials. The Declaration now provides guidance on when it is ethically acceptable to use a placebo, particularly when effective treatments already exist. This ensures patient welfare is not compromised. Another significant addition involved provisions for access to post-trial benefits. This addresses the ethical obligation of researchers to ensure participants, especially those in developing countries, can access beneficial interventions after a study concludes. It promotes fairness and equity. Provisions were also included regarding the sharing of research results. The Declaration now emphasizes the ethical imperative to disseminate research findings, both positive and negative. This prevents publication bias and contributes to the global body of knowledge. The most recent revision in 2013 further clarified the responsibilities of researchers and ethics committees. It provided more explicit guidance on managing conflicts of interest and ensuring the independence of ethical review. This continuous refinement enhances its practical application. While the Declaration of Helsinki is not legally binding in itself, it carries immense moral and ethical weight. It serves as a powerful international standard for ethical medical research. Its influence is felt across national borders. Consequently, it has been adopted as a standard by numerous countries and institutions worldwide. Many national laws and regulations governing human research are directly inspired by or incorporate its principles. It forms the bedrock of ethical research governance. Its influence extends far beyond purely medical research, impacting other fields involving human subjects. Disciplines such as psychology, sociology, and public health often look to the Declaration for guidance on ethical conduct. Its principles are broadly applicable. The Declaration continues to be debated and interpreted, reflecting ongoing ethical evolution. As science advances, new questions arise, prompting continuous discussion and refinement of ethical principles. This ongoing dialogue keeps the Declaration relevant. Despite these ongoing discussions and interpretations, the Declaration of Helsinki remains a vital document. It stands as an enduring beacon for safeguarding participant rights and well-being in medical research. Its legacy is one of profound ethical commitment. It reminds us that scientific progress must always be tempered by human compassion and respect. The Declaration ensures that the pursuit of knowledge never overshadows the fundamental dignity of the individual. It is truly a cornerstone of medical ethics.